Well, how much influence do lobbyists have on the push into health care reform?
According to the website 538.com, it could be a lot. The healthcare industry reportedly spends about $1.4 million a day on lobbying. The biggest hospital group, the American Hospital Association, spent $3.6 million in lobbying for the first quarter this year. Nate Silver is the president of 538.com. He joins us now. Nate, it's been widely reported there are 4 times as many lobbyists for the healthcare insurance industry as there are members of Congress. You've broken down the amount of money and the impact on senators. Explain what the impact is and who might be vulnerable or who might see their position change as a result of the money.
Well, it's very substantial and very obvious when you collect data on how much money each senator's gotten over the last 6 years. It's a full senatorial cycle from the healthcare industry, from the insurance industry, I should say. Getting even like an extra $40,000 might lower his odds for certain senators of supporting, say, a public option, which is a competitive plan the government would build by as much as 50%. If they're smart, they should be targeting moderate to conservative Democrats. Republicans won't support a public option anyway. The liberals will, no matter what. But people like Mark Warner in Virginia, who raises a lot of PAC money, people like Kay Hagan in North Carolina, another freshman, and senior people obviously like Max Baucus or Kent Conrad, who are from red states, are more moderate on some issues. But they're all getting a lot of money from insurance.
You mentioned Max Baucus. Here are the top recipients of PAC money from healthcare industry since 2004. And of course, Max Baucus is the chairman of the committee that's dealing with most of this. Max Baucus, $141,000. Senator Mitch McConnell, nearly $111,000. Senator Ben Nelson, Democrat, $106,000. Republican Senator Jon Kyl, $106,000. Republican Senator Judd Gregg, $103,000. Again, Nate, you point out that the effort to essentially have money go through the system could cost the public option advocates as many as 9 votes. The key figure on this list, Max Baucus, in part because he's got control over what comes out of committee?
Yeah, that's part of it. Is you have, literally a dozen different health care plans floating around the Congress between the House and the Senate. And it's really kind of a floor fight right now, an insider's fight about which bill wins the race to the floor. And the people who have the most influence are people like Max Baucus and Kent Conrad, who get a lot of money from the insurance industry. It's money, frankly, well spent if they want to have an effect. But, I'm a little suspicious when someone like Baucus says, yes, I support a public option in theory, but it's not going to be bipartisan when, in fact, the people who are paying his bills, it's probably not in their best interest.
But Nate, isn't this, when I looked at this, David pointed out your numbers to me, isn't this what people feared all along? When we saw all of these healthcare industry people come up to the White House and say that they were finally on board, you had writers very skeptical of their intentions here. This is exactly what we were worried about.
This is how politics works in Washington. We've run the same analysis for, the bank bailouts. I've done it now for, for the climate bill that passed the House on Friday. It's pretty clear that money walks and talks in Washington, and it doesn't necessarily take that much to sway a vote.
Nate Silver from 538.com. Nate, terrific work as always. Thanks so much for coming on, and really excellent analysis. And anybody who cares, Tamron, about the influence of money in politics, you look at these polls, 76% of the public, they want the public option. They'll be lucky maybe to get 40 to 45 U.S. senators to support it. And why? Because of the money.
And it is startling, the dollar figures that are out there. Well,